We have to be millionaires because I don't know why we cannot be millionaires. If this person is a millionaire, I can do it too, right? It's not about jealousy, envy. No, you can do it too.
I also see in you a passion to help. It's not just about you.
Yeah, I want to
Yeah.
help too. I
Mhm.
love to help people. I'm a very nice person. I'm very enthusiastic.
Mhm.
What can I say?
You're
I'm
dynamic.
very enthusiastic. People will say I'm like my father.
Hello and welcome to another episode of Chatting with the Experts, the show where I speak with incredible women from Africa, from the Caribbean, and in the diaspora. The title of today's episode is Build to Rise. And with that, I welcome Annouchka Ondias-Kouamé, also known as Dr. OK, to the show. Welcome, Dr. Annouchka, to the show.
Thank you.
Thank you so much for saying yes. I appreciate you
Thanks.
taking time to come and educate us on so many things. Your bio is impressive. You're a pharmacist, entrepreneur, you're a wellness expert, and you're an AI healthcare innovator. Wow. How did you go from pharmacy to being an innovator?
First of all, I came to the United States as an international student in 1996. So I went to high school here in New York. So I went to school to study pharmacy.
Mm.
So I went to pharmacy school in New York where I graduated from St. John's University. So after graduation, I moved to Maryland and I started working as a pharmacist. So I have a strong clinical pharmacy background. I work for different hospital. I expanded my traditional practice to build purpose-driven health and wellness businesses across Africa, specifically in Gabon, where I have a health and wellness center where I specialize in vitamins supplement. And also in Ivory Coast, I have a health and wellness center there. So I transitioned from pharmacist to entrepreneurship because God gave me a vision. God gave me a vision to impact. He gave me a purpose. So I wanted to be committed to my purpose and impact people positively, for people to feel better, to live in good health. There's also a story behind my health and wellness center because it's been 14 years now. I'm a cancer survivor.
Oh,
Yes.
okay.
So during 14 years ago, during my treatment, I met a lady who told me to take vitamin C every day. So
Mm.
that's how I start doing research on vitamins, and I found that vitamin can protect you from getting cancer. That's how NaturEllie was born.
So you're a cancer survivor.
Yeah, 14 years now.
14 years. I
Yeah,
am celebrating with you.
yeah.
And through that experience,
Experience, yes.
naturally was born.
Born, yes.
Okay. So it sounds to me like naturally is less pharmaceutical and more like using natural. Um,
Yeah, because I wanted to, and also, I wanted to transition to entrepreneurship because I didn't want my 9 to 5 to leverage me. I wanted to leverage my 9 to 5. I wanted to turn my experience, my skill to make impact and make profit
mhm.
because I believe that we are born. I believe that God gave us the power. It's in the Bible. He gave us the power to get wealth. I
Yes,
believe that all of us should be millionaires.
I agree.
All of us, we have to be audacious to make an impact, to get out of our comfort zone.
Mhm.
That's why I decided to transition from pharmacist to entrepreneur.
Got you, got you, got you. So that's what, I mean, your unfortunate illness, which thank God you're better,
Mm-hmm.
and also looking at scriptures, the Bible,
The Bible, yeah.
encouraged you to
Encourage, yeah.
transition from
Transition, yes.
pharmacy
Yes.
to
Pharmacy,
entrepreneurship.
entrepreneurship, yeah.
Okay. So let's talk about how does pharmacy meet AI? How does wellness meet AI? How does the AI come into this? Because 14 years ago, there was no AI.
There was AI, but we didn't know about it.
You're right. As I said that, I got a check in my spirit. There was
We
AI.
didn't know about it, unfortunately. Because people who knew about AI, they are millionaires now.
Yep, you're so right. And we were hailing them and say, how do they, how do they do
Yeah,
it? Okay.
yeah, they are millionaires now. People who knew AI 20 years ago, because I'm following this girl. She's an AI expert. She's been in AI 20 years ago. So it exists. So because we weren't aware of it.
We just weren't aware of it. Just slap.
Now we are just aware of it because it's getting implemented everywhere in America now.
Mm-hmm.
So it's a new era. It's the era of digitalization. It's the era of AI now, after COVID now.
Yes,
So it's a mindset shift.
absolutely.
What I mean?
Absolutely.
It's a mindset shift because a lot of people still don't believe in AI. Can you imagine?
No, I can't. It impacts our
Especially
lives
especially in
so.
Africa. I have a
Mhm.
lot of friends, they don't believe in AI. But AI is coming after us. So if you don't learn AI, study AI now, in 5 years, 10 years, you're done.
I don't even know if we have as much as 5 years. I mean, you
It's
see it,
it's here now.
it's here.
It's
And
here.
and it's impacting our lives very rapidly. I mean,
Rapidly, yes.
even if you look at the models, they went from 4.0
Yeah.
and now we're at 5.2 for the chat
Yes.
GPT at least. So yeah,
Yeah.
it's moving
Yes.
very quickly.
Yeah. So, I'm a pharmacist, right?
Hmm.
I have a health and wellness business.
Hmm.
And I have a consulting business where I do medication therapy management, I do drug safety, I do pharmacovigilance. But last year, I combined AI in my business.
Okay.
So when you have a business, you have to combine it with AI now because that's where you get a lot of opportunities because there's a lot of money on grant contract here in America, even in Africa now. When you have an AI business, you have a lot of opportunity to get grants, to get contract.
Mhm.
So you have to go after the opportunity. Do you understand? So it's a mindset shift. So the way I think now, people will not understand me. But if you do a lot of research, you follow a lot of people who does AI, you will understand that AI is already there. So you have to take the opportunity to
Mhm.
learn AI and teach AI to impact and make a profit.
So tell me how you are. Okay, let's talk about wellness now. How are you
Yeah.
using AI for, prevention as a digital health tool? I know that your business is primarily in Africa, in Gabon and Ivory Coast, if I recall.
Mm-hmm.
How
Yeah.
are you using AI now to help, improve health and wellness or improve the healthcare back in those two countries? Because I know you are tied to those two countries.
So it's AI is fast.
Mhm.
If I have a client, he has a concern, he has a lot of question, AI
Mhm.
will help me. Like I use
Mhm.
ChatGPT a lot.
Mhm.
So it helped me to personalize my
Mhm.
wellness guidance.
Mhm.
I use AI to help translate hard health and vitamin information into personalized, easy to understand wellness guidance based
Mhm.
on lifestyle, symptom, and the client goals. So the client can make informed, safer choices.
Mhm.
So I use AI to educate. I do a lot of workshop. I use AI to do my workshop. It allows me to educate people, thousands of people at once through digital tool, content, workshop, chat based on support about, I teach about prevention, self-care, and without replacing medical advice, of course. So I do a lot of stuff with AI. It helps me a lot and it's fast. And I get access beyond borders. So it helps me reach community in Africa easy and the diaspora who lack easy access to healthcare education, bringing trusted knowledge, wellness knowledge to their phones in a cultural relevant way. So it's AI. Everything's digital now. I do podcasts, I do workshop, I do masterclass.
That's very impressive. Like you, with a background in pharmacy, and now incorporating technology into what you
Technology.
do
Yes.
in order to create awareness and to help
Yes.
people.
Yes.
In those.
So people will ask me, oh, you are not an expert in AI, in IT. You don't need an IT background to know AI. You just need to read, to be curious.
Mhm. So are you now, in addition to, the healthcare, as you say, expanding your business to, because with AI, you're using it to, like, as you say, quickly diagnose or help someone who has a medical concern. And the main two countries, again, I'm going to say Gabon and Ivory Coast. Are you also using it as a tool to educate them, showing them how to use AI for their day-to-day living, how to use AI, like if they will have to ask a question or they're reading something in French, they can use it to translate very quickly into English and other, educational
Yes.
ways.
Yes. AI will translate it in French for me and for them.
For them.
Yes.
So I know you talk about building impact across Africa. Expand on that, like, how do you scale that in a way that is purposeful and the people that you're talking will realize that there is a purpose behind the work you're doing?
Like building across Africa?
Yes. You said you're breaking down borders because of what you're doing and how you scaling, purpose-driven health businesses between Africa. And let's break it down again. There are two countries in Africa that you're really concentrating on. Am I correct?
Yeah.
Okay. So how are you breaking down those borders and scaling businesses between the US and Gabon and Ivory Coast?
People always say, how do you have a business in Africa?
Mm-hmm.
How do you trust people? They're going to steal your money.
Hey.
They're going to do this. They're going to do that. How do you cope? Business is taking risk.
Mm-hmm.
Risk is faith. Like I say, I'm always going to quote the Bible because I'm here today because of the grace of God.
Amen.
I'm here today.
Go ahead. I also quote the Bible. I'm a Bible believing podcaster.
Yeah. So I start taking my vitamins because I went through something. Maybe God wanted me to grow through it to make an impact. Sometimes we go through suffering. Maybe there's a purpose behind it. And today I am alive. I am in good health, 100%. They are even surprised. Like, I just want to thank God. That's why I created it. So everything I do is faith-based. Having a business in Africa and you live in the United States or Europe is very hard. But you have to believe in your vision because God gave me a vision, right? That I have to fulfill. I have to be committed. So God will always make a way where there seems to be no way. I'm not saying that having a business in Africa is easy, but business in general is not easy.
Correct.
Even here in America, people have business here. They still get they still have problems, right?
That's why we have spam preventer and scam.
That's why, right?
Yep.
That's how you have to believe in your business. Because nobody else will believe in what you are doing. It's only you. So you will have the naysayer. People will say negative stuff, but you have to stay focused. You have to you have to be disciplined because through discipline, it brings consistency, it will bring success. But if you are not disciplined, if you are not focused, you fail. A lot of my colleagues, a lot of my African friends, they are scared to have business in Africa. But you cannot be scared because God didn't give us a spirit of fear, but a spirit of power and sound mind. So you have to use that power that God gave you, believe in your vision, have the business, and God will take care of the rest. There's going to be up and down. I opened since 2021 in Gabon. I was in a small boutique, a small place. People stole, my sales assistant stole money, but I'm not going to let that to close. That's how I'm going to think. I'm going to sit down. I'm going to scale the business. I'm going to put system to prevent theft. You have to put systems. You have to scale. You have to automate. But in order to do that, you have to spend money to make money.
Yes.
So a lot of people are scared to spend money. But business, you have to spend a lot of money. I lost a lot of money. I spent a lot of money. Now I see the profit. A lot of people, they are not patient, especially African. We are not patient. We want to see the result right away. No, business is not like that. It's perseverance. You have to try it, like iterate, start it over again. Be disciplined, be focused, and you will see that your business will succeed after. And, and you need to look for partnership,
Collaborations.
Operations. It's very hard in Africa when you brought from America. You had to go through customs. You had to pay them. You had to get these papers to open your business. So there's a lot of stuff, but everything is possible. It's always possible. Sometimes they come and do inspection. You don't have this document. You don't have this document. You learn every day in business.
Absolutely, yes.
And also when they see that you are trusted, because I lead with trust, education, I do a lot of workshop there. So they know you, they will trust you, and that's how you get contract.
Yeah. They know you, they trust you.
They trust you.
And they get contracts. So now you're talking about contracts and you're talking about contracts. Let's focus on Africa. Talking about contracts in Gabon and Ivory Coast. So how have you been able to revolutionize like drug safety? How have you been able to get contracts that has enabled you to go into some of the rural areas and do medication management? How have you been able to do that? Because I know that, as you rightfully said, there are lots of obstacles that you have to overcome. But I think with using AI, how have you been able to overcome some of those obstacles, like being able to, talk about medication safety, because that's a problem we have back home. I'm also for that.
Yeah.
How have you been able to use AI for that? I think I've repeated that question over and over because I'm very interested. I'm intrigued.
So for my AI business now, it's still a startup.
Okay.
It's still a startup. So I'm looking for investors.
Oh, okay.
So I haven't get any contract yet, but I have investors that are interested.
Okay.
So I'm preparing for pitches. I go and talk about it.
Okay.
And hopefully, because I have one investor who is interesting, because it's about drug safety, pharmacovigilance. There's a lot of mistake, a lot of drug safety issue, especially in my country. I don't know about other countries, but when I read the article, there's a lot of drug safety, pharmacovigilance issue in Africa. So that's why I wanted to bring out, I wanted to combine AI, to help this country, to help the hospital with a system to catch medication error, to prevent medication error.
I know that happens and there's less accountability there.
Yeah. So PharmaEllie, it focuses what is often neglected, like medication therapy management, pharmacovigilance, and error prevention, areas that directly impact patient safety and healthcare costs, because there's a lot of mistake that can be prevented through the system, through AI.
That's so true. That's so true. So just before we wrap up, because I mean, I'm really intrigued with what you're doing. Can you tell us about one case, without disclosing names, that you've seen how, what you're doing has been helpful in either Gabon or in Ivory Coast, where you've been able to use AI in, like, what did you mention? In
doing
helping. Go ahead.
like mostly AI or the NaturEllie side?
Yeah, I was thinking
Both?
about, like, have you had a case? I know this, you said this is a startup. So have you had an opportunity to actually use AI in a case with a patient in Gabon or Ivory Coast where you were able to use AI to facilitate the drug safety or to even help with the medication management? Have you had any case like that, or it's too early to call that at the moment?
It's too early to call that because
Oh,
I'm still a startup.
okay.
I'm still a startup, but I talked with the director of the health center in Gabon.
Okay.
So they have a huge issue with drug safety. So I gave him uh, some advice about implemented AI combining with pharmacovigilance and drug safety. So right now I'm planning to go back to Gabon in March to meet him and talk about my platform, the AI power of pharmacovigilance and drug safety to see if they'll be interested in implementing it.
Okay. All right.
But with NaturEllie, I have a lot of cases.
All right, because that was good. That's why I smiled. I said, okay, now let's go to NaturEllie, because that
Yeah,
one I know was before this one, PharmaEllie.
yeah, yeah. So, NaturEllie, I have a lot of cases. I have a lot of clients, that come to me that are suffering from chronic condition like hypertension, diabetes, cancer. And, I gave them an advice on what vitamin to take. So when I give them the recommendation and they buy it, a month after, they will come back to me and say that they feel better. So I get very good testimonies.
Wonderful.
I get good testimonies, I get very good testimony through my consultation. Because before the consultation, when I have a client, who want to talk to me, who want to go through the consultation, I pay a lot of attention. I ask them what they need. I ask them a lot of questions. And from them, I came back with recommendation. So it takes a lot of research for me because I have to make sure that the vitamin is good. It's a quality vitamin. I don't buy anything everywhere. I buy organic quality vitamins. And I know that the vitamins will work on the client and the client will feel better. And a month, 2 months after, you come back and give me a testimony. So that's what I'm looking for.
And that doesn't in any way prevent, because like pharmaceutical, there's big pharma, and then there's the natural organic going back to the roots. They're kind of like on opposite ends of the spectrum, aren't they?
Yes, yes.
So I'm thinking that because you're a pharmacist, you're also able to know that, okay,
Yeah,
go ahead.
yes. Because everything is NaturEllie. NaturEllie is mostly my story, what I went through. NaturEllie is nature and Elijah. I just wanted to,
That's where that comes from.
that's comfort. Yeah. It's just to say, thank you, God.
Hmm.
Nature, God created the earth.
Mhm.
And everything nature, it's healing, it's therapeutic. And Eli is Elijah, is God. Now, PharmaEllie is pharmacy and God because I'm a pharmacist.
Mhm.
And everything in PharmaEllie is what I'm doing at work as a pharmacist. So it's my skill, my experience combined with AI. I made it a business.
Whereas NaturEllie is your story
It's
of
my
how.
story. Yeah. PharmaEllie is my experience as a pharmacist combining with AI to say God gave me the knowledge, right? And I have a third business now, a coaching business. which is a faith-based business coaching. I said faith-based because God gave us, like I would say, everything is possible. Through God will give you strength. So you can do anything you want in life. Through God, if you want it. You can do anything, anything, if you put your mind into it.
I agree. I agree 100%. But that will have to be for another show. We talk about you using faith and leadership and your coaching, because that's what I'm hearing from you.
Yeah.
You know?
Yeah. Because we have to be millionaires, because I don't know why we cannot be millionaires. If this person is a millionaire, I can do it too, right? It's not about jealousy, envy. No, you can do it too.
I also see in you a passion to help. It's not just about you.
Yeah, I want to help too. I love to help people. I'm a very nice person. I'm very enthusiastic. You know, what can I say? I'm very
dynamic.
Enthusiastic. People will say I'm like my father.
Mm.
My father was a businessman.
That's...
He was a general of the army and a businessman. Yeah.
And in such
And I know what I want.
And you go after it.
I want to be a millionaire, so I have to go after it.
Go after it.
Right?
I commend you for that. I celebrate you for that. All right. So because we know that people in the audience who want to ask you questions, but then this is also going to live on YouTube and Apple Podcasts and Spotify. Someone who is listening or viewing this show, if they've heard what you're doing, and they're very interested in getting in touch with you, where can they find you online?
Oh, sorry. Can you repeat it? Let me.
Okay. So I'm asking, how can people get in touch with you? If they would like, if they're not in the audience, they're listening to this at a later date, because it's going to be an audio podcast on Spotify and Apple Podcast, and it's also going to live on YouTube. If someone is listening or viewing this and they want to talk with you or get in touch with you,
they can get in touch through LinkedIn. It's under Annouchka Ondias-Kouamé. They can get me on Facebook, Annouchka Ondias-Kouamé. They can get me on Instagram under Dr. Kanush. They can get me on social media.
Okay. All right. So we've dropped all of that in the chat so that anyone, and it will be in the show notes too. So if anyone is trying to get in touch with you, they can accept
yes.
That. Okay.
Yes.
And for those of you who have heard the story of this dynamic, entrepreneurial pharmacist who is using pharmacy and AI to improve healthcare in the two countries in West Africa that she's very much connected with, which are Gabon and Ivory Coast. If you'd like to be a guest, just as she has been on Chatting with the Experts, reach out to me on my website, which is chattingwiththeexperts.com, or you can get in touch with me on LinkedIn. My business page there is Chatting with the Experts. You can also look for Paula Okone. That's my profile. I am on Instagram. My handle there is @chat_experts_podcast. I'm also on Facebook. Business page there is Chatting with the Experts. And you can also search for Paula Okone. And last but not least, but very impactful, is our YouTube channel. I ask that you subscribe and like and support us as we showcase the voices of experts from Africa, from the Caribbean, and in the diaspora, who are educating women, who are encouraging women and empowering women, not just in Africa, but all over the world. Thank you so much, Dr. Annouchka. And now we'll open up the floor for those who have joined us to engage with you even more and ask you additional questions. Thank you.